well, asking for the next 2 weeks to halve the number of our international overseas arrivals. I think this is very important for 2 reasons. The first reason is we want to be able to concentrate on this contact tracing, but secondly, we are actually seeing large numbers of positive cases that are coming in. Like basically every day over the last fortnight, we've been seeing 5 or 6 cases, and the Health Minister will give more details, but we're almost at the capacity of our hospitals that we were during the peak of the pandemic. That's not to say our hospitals can't cope, they will be able to cope, but this large influx that we're seeing and the high rates of people coming back, return travellers being positive, for the next 2 weeks I'm asking the Prime Minister to halve our number of overseas returning travellers, and I'm quite sure that he'll give that due consideration as soon as possible.
What is that current intake number?
It's about 1,300, so we're just asking for the next 2 weeks, just while we get everything under control, and the fact that we are seeing these, as I said, every single day we're getting positives out of hotel quarantine.
Premier, are the other states justified in declaring Brisbane a hotspot?
Look, that's a matter for them. We are not seeing large-scale community transmission. It's just the close contacts. We're very comfortable where we are at the moment, and if anything changes, we will update the public.
What's your reaction to the football in Geelong last night, where there's been criticism that it took so long for that to happen and what actually occurred at the ground?
That's really a matter for them. That's a matter for the Victorian government.
The new close contact has tested positive. Is that a family member who lives with the 26?
My understanding, it's a friend. Different household.
Okay, at one of the venues already listed, but eating lunch at the same time?
It was a close contact, yeah. Could have been at their house. Yeah.
And we did only have 6,000 tests. I know you said that was triple the number in Brisbane.
Yeah.
But would you like to see more testing?
We'd always like to see more testing, but that's a really good indication that Queenslanders are responding, especially in the southeast here. So we do want everyone to do the right thing. So thank you for everyone who's come forward and got tested. And if you are at home and you've been to any of those places and you're sort of thinking, oh, I'm not feeling too well, don't think about it, go and get tested.
Premier, how serious is this on the scale of what we've seen to date, this latest situation?
Oh, look, I think everything's always of concern, but we've learned a lot over the pandemic. Our contact tracing is in place. We've got excellent contact tracers, and everyone appears to be doing the right thing. But like I said, we really want people from that Carindale shopping centre that were there for that particular period of time to please come forward and get tested. I mean, that's pretty crucial so we can rule out any further community spread.
And why was the advice for Mama's Italian restaurant escalated to more high risk?
Yeah, I might get the Health Minister to address that. Okay. Thanks, Yvette.
What we do know is cafes and restaurants are higher risk because people are sitting there for a period of time. What we learned in the last 24 hours is this gentleman had actually been at the restaurant for almost 3 hours. And so consequently that means that there's greater risk, and the Chief Health Officer's advice and Queensland Health's advice was that anyone who has been at this restaurant between those times on the 21st, so last Sunday, should quarantine for 14 days, irrespective of whether they get a early negative result from any test. So they still need to go get tested, but stay at home for 14 days. We do know these sites are at risk. Just on the issue of the testing, although we're seeing testing numbers around the same as what we did the day before, we have had a look and we've seen a significant increase of people coming out getting tested, both in Metro North and Metro South areas. So we've seen probably a decrease elsewhere in the state, but where we need it most, which is here in southeast Queensland, in northern Brisbane and southern Brisbane, people did come out in significantly more numbers yesterday to get tested, and we thank them and we ask them to continue that over the weekend.
How's the record tracing at the Redcliffe restaurant? Have you been able to find all the details of people there at that time on QR codes, or is that why you're asking people to come forward?
I've asked that question today, and that work is still ongoing to see how the restaurant has gone with its checking in. But of course, while that contact tracing is ongoing, we say don't wait for the call. Come forward and quarantine yourself and get tested. But assuming that everyone has done the right thing, there should be a comprehensive list of everyone who was there for the 3 hours last Sunday that we'll be able to contact. But don't wait, get yourself into quarantine and go get a test.
Minister, should the tourism industry have any concerns in the lead up to Easter about, potential lockdowns or?
Oh, look, the Premier's already answered that. One day at a time here. We're very happy with the response the position we're taking at this stage. We've learnt a lot over the last 12 months, as the Premier said, and we believe the restrictions we've put in place at the moment are adequate based on what we are seeing. And of course, the next 24, 48 hours with the contact tracing will tell us more.
Last one.
No, so we do have genome sequencing back, and the first 3 cases, so the person who came from overseas, the transmission event in the hotel to another person, and the transmission to a healthcare worker at the PA hospital, those 3 genome sequences are exactly the same and are exactly the same as this gentleman who's tested positive who lives in North Brisbane. So those 4 are the same, which suggests that there's probably, given timing, one intermediary between the first healthcare worker and this gentleman, we believe. There could have been 2. They're the things that we're going back and looking at. We've rechecked all of those up to nearly 900 contacts, and all of those were tested negative. Those are the contacts of the healthcare worker, so we're just looking at where else there could have been some transmission. There's every chance we won't find it, because we know people, of course, can get infected and be totally asymptomatic and then pass it on. So we just have to work that through. The most important thing, and will give us the answer, is that anyone who's sick in Brisbane comes forward and gets tested. People shouldn't think just because they haven't been to one of the venues of concern, they haven't got it. They need to come forward. Anyone, anywhere in Brisbane, or Moreton Bay Regional Council who's unwell with any symptoms needs to come forward. That's really important.
Dr. Young, can I just confirm, have many of the close contacts of yesterday's confirmed case returned negative results yet?
We've had 4 so far, so we're just going through all of that information this morning. It would have come through overnight, but we've only seen the 1 positive.
Thanks, everyone. Premier, can I take one question? The JobKeeper comes off tomorrow.
Yeah, I was just going to mention that. Yeah.
Just want to mention that it comes off tomorrow.
Yeah. Yeah, look, thank you, and that goes back to your earlier question about tourism. Having been up to Port Douglas and Cairns and sat down and spoken to our tourism operators, they are absolutely concerned about the fact that JobKeeper ends tomorrow. I still call upon the federal government and the Prime Minister and the Treasurer to please look at some further targeted assistance for these particular people. They work really hard, they contribute to our economy, they've got families to feed. Some targeted assistance for people in this industry would not go astray.
Premier, Queensland MP Andrew Laming, he laughed about the policy he made in Parliament. Should he be sacked?
I am very concerned that any MP would go about trolling. I mean, that's not on, and it's disgraceful. So that's a question for the Prime Minister. But honestly, in this day and age, the trolling has got to stop. I think it's about time that as a nation we actually came together and started talking about ways in which we can stamp out these practices that are having detrimental effects on women, on children and other people in every walk of life. Now, gone are the days where people used to write letters to the editor and put their name and addresses. I think it is absolutely a coward's way to be trolling people without putting your name to it, and the practice must stop. Now, going back to your earlier question, for an MP to be trolling is absolutely disgraceful. Okay,
Thanks, everyone.